what attracted me to the invite to work for Right by You was the fact that it was a possibility of working with individuals who had acquired a cancer diagnosis, but were either on the move or experiencing homelessness. So the trajectory of their treatment, care, palliation, end of life was presenting some challenges, and we were failing as a society, many people in that situation. So I had seen that occurring over my 30 years of primary care work. So the opportunity to work with individuals in that situation, whether their treatment outcomes were positive or whether we were supporting them towards the end of life, in the context in which they found themselves, was really, really a welcome challenge. Started with simple things like acquiring equipment. If you order it, that's fine through the NHS, but providing you are in a venue they're happy to deposit it in. I had a very abrupt conversation with somebody who worked for the Red Cross who told me that they don't lend wheelchairs to people living in hostels in this particular area. That may not be true for the whole of the country, but certainly in Hampshire, I was told quite succinctly that that would not be a possibility. And when I raised the issue of why, it was simply because they were all considered to be untrustworthy and unable to return their wheelchairs. So that took a deal of work and a deal of negotiation, both with the local Red Cross and the wider team, to secure some equipment for a particular woman living in a hostel. The challenges of supporting someone undergoing treatment and dealing with side effects when their living conditions are precarious, but also to acknowledge that they're unlikely to relinquish habits that they may have acquired, and that might just simply be smoking, but it also might be the use of illicit drugs or alcohol, and allowing people to make choices around those, and for that to be tolerated within the regulations of a particular building, because those hostels do tolerate that behaviour in somebody not going through treatment, and also encountering a deal of prejudice around those individuals choosing to continue with those habits from the NHS staff that they encountered. The simple thing of anticipatory meds that would be kept in someone's home, suddenly you have no place to do that. If somebody's on the street, how you link them up with their anticipatory meds or find a place to do that is a challenge. And it's also difficult in a hostel where there's no CQC coverage. One has to consider whether it's safe to leave those in a room where other residents may have access to them, even locked in a safe, or whether one has to go down the route, as some hostels, particularly in London, have, of becoming regulated by CQC in order that they can manage controlled medication. An old issue for myself around public health funerals and how those are managed nationally, but particularly locally. And that's a real issue around choice when one is planning someone's end of life and wishing to fulfill their own ideas about what might be done with their ashes, particularly if you're not allowed to have those ashes because the funeral has been funded by the city council. So I've begun to take up those cudgels both with the city council, but on a wider level with national parliament, because there is good guidance, and I'm sure variation of how they're interpreted nationally makes a big difference, but there are changes that require us to push that legislation and look at funding up and down the country. So that's been interesting itself. Just about legacy, estranged members of the family, children, parents, siblings that people have wanted to either reconnect with during this period of time, or simply want to leave some kind of memory, a letter, photographs, a bit of a story that we can pass on to those loved ones when we contact them. And I think, being able to facilitate that choice and actually have a discussion with people and give them some agency in their own life has been a real eye opener for me. Right by You for me offers me that opportunity to glue together the care that's happening in the community and people in the context of their lives, messy and untidy as they are, and the fantastic care that's provided by the Acute Trust to attempt to alleviate both disease and suffering. So I consider myself to be a sort of very sticky, treacly glue between them. And I draw on my team members who are cancer nurse specialists, which I'm not. I'm a jobbing nurse with a lot of insight into services for people experiencing homelessness and people on the move. So for me, it's that opportunity to glide seamlessly between those services, hopefully to a point where the individual concerned doesn't see the join.